Well, my experience has been a number of sports injuries, a number of surgical procedures that didn't turn out as well as I had hoped. And as time went on, I actually became more and more somewhat disabled from the chronic pain, that I couldn't carry out a lot of what activities that I used to do regularly on a daily basis as a chiropractic physician. But when I learned about PRP, it was something so new and so different and so interesting that I had to learn more about it, because the thought of actually being able to regenerate tissue that had been torn, that had been damaged, that had been worn away from athletic injury, from wear and tear, and to have that actual possibility be there to actually regenerate the tissue and bring life back into a joint was certainly at least a fascinating option.
How is your knee?
My knee is 90 to 95% recovered from better than it was when I started 2.5 years ago.
We use a fluoroscopic x-ray machine where it measures inside of the body in 360 degrees. It gives us pictures in any direction we like. He has some mild arthritis in the wrist, and we start by marking the spots that we want to inject. We clean the wrist up. And we'll numb him up a little bit. Give me the cold spray, please. We use this so it doesn't hurt so much. You okay, Mr. Cook?
Yep.
Okay, now we inject the PRP into the wrist to platelet-rich plasma. Okay, that's it for the wrist. Once we numbed him up with the cold spray and the anesthetic with that tiny little skinny needle, he was pretty numb through the whole procedure. Didn't feel almost anything. Would you say?
True.
Would you say?
I'm 71 years old.
And what has been the problem that you've had? Your knee?
Well, I broke my ankle two years ago. And then after that, my knees were starting to give me a little problem.
So here we're doing a knee. We mark out our entry sites. We numb up the knee a little bit. Does that hurt much?
I don't feel it.
You didn't feel it? Does that hurt you?
No. I'm fine.
What I'm going to show in this picture is that with the x-ray and the fluoroscope, we can direct the platelet-rich plasma exactly to where the arthritis is worst and treat that specifically. I mean, how many people out there have arthritis in their knees and they need to go to total knee replacements? When a treatment like this can buy them another 8-10 years or more for their knees, you know? Or if you get someone early enough, you might be able to prevent them from getting a knee replacement altogether.
I feel there's always a better way than cutting all the time. I'm sorry. Once they cut me and put metal and what have you inside my bones, if that doesn't work, what are they going to do next? So I want to extend myself and take every opportunity I have to try all the natural procedures or new procedures that are going to help, that are beneficial without cut all the time.
It's like leaps and bounds from, yeah, the difference, yeah.
Were you curtailed a lot in your activities before you started this?
Yeah. I couldn't even like lift a glass of water. It would hurt to type. You start using the mouse on the other side. You know, every little thing, you know, that I would do with this arm hurt.
Okay, we're applying some sterile ultrasound gel. And what we're using here is the same type of ultrasound machine that is used for OBGYN looking at babies, only we're using this now for musculoskeletal. And in this situation now, we're looking at the outer portion of her elbow, and that's the screen. And that is the tendon that she has a problem with, right in there. Now this is the tendon that we're going to be injecting. I'll put an arrow on it. Okay, so we're going to numb it up a little bit. You're going to feel a little pinprick. In the screen there's like a little wobble effect. That's the needle. I think you can see the tip of the needle. It's a beautiful picture going right down onto the elbow. Now we're injecting. You're seeing the swelling and the movement. That's the whiteness of there. That's the platelet-rich plasma going in, and going all around. You can see how it's turning white there. That's the PRP going into the area where the tendon hits the bone there. I'll just show you the movement of the needle so you can see where it is again. It's coming in from that angle now. And then we're injecting it down along the right-hand side of the screen. Now we're going to move up a little bit. And we'll inject it a little bit higher. The needle, I think you can see coming down on the right-hand side of the screen. It's at about, say, 1 o'clock. Can you see the wiggle? And now we're going down and it's hitting the tendon right there. And now we're injecting. You can see the medicine going in just because of all that movement that's there. That's the medicine going in. And that medicine carries the growth factors to help heal the tendon there.